Hello, and welcome to this Bolder Healthier Champions webinar series. I'm Dr. James Barnes, a GP trainee currently working in Birmingham Public Health. This month, we'll be looking at diabetes and its impact on the Birmingham population. These slides will broadly outline what diabetes is, the scale of the problem, and the ways in which Bolder Healthier Champions can help alongside public health interventions. To start with, we'll just do a quick recap of diabetes, including what causes it, some of the symptoms that we might see, as well as a little overview of the treatments. As a refresher, diabetes is a lifelong metabolic disease which is caused by an underactive pancreas gland and leads to uncontrolled high blood sugar. In a few moments, we'll look at more detail into the two main types. Although in the early stages it may be treatable or preventable with just lifestyle changes alone, many go on to need medications such as tablets. These may aim to reduce the blood sugar, increase the production of insulin in the body, or improve the efficacy of the insulin that is circulating. In some patients, however, insulin injections are needed multiple times a day to replace the insulin that's not being produced. Without treatment, diabetes can be very serious, causing problems over time with kidneys and eyesight, and can even lead to limb loss and diabetic foot disease. Patients are also at risk of cardiovascular problems such as heart attack and stroke. Broadly speaking, there are two main types of diabetes that we'll focus on today. Type 1 normally starts at a younger age, often in childhood, but can be seen at any point in the life course. It is caused by an autoimmune attack on the pancreas, causing destruction of the beta cells that produce insulin. Whilst there's ongoing research into the disease, it's not currently preventable and often requires lifelong insulin. Where the main research progress today is in use of technology for monitoring, with wearable glucose monitors improving the ways in which people with diabetes control their disease. Type 2 diabetes is more related to insulin resistance, where the supply of insulin can't keep up with the needs of the body, or the body cells become less responsive to insulin. There is a significant link between diabetes and obesity, and it's considered to be largely preventable with lifestyle changes. We'll look later at pre-diabetes and the role in screening. Bolder Healthier Champions can have most of a role here in terms of promoting healthier lifestyles and raising awareness, and most of this talk will focus on this. It's worth at this point briefly mentioning that there are a number of other types of diabetes. One of these is gestational diabetes, which lies slightly outside the scope of this presentation. It is found in pregnant women, but sometimes will progress to full diabetes after the pregnancy, and those that have gestational diabetes need to have annual screening to make sure they don't pick up diabetes in later life. In terms of the symptoms that we might see in someone who has diabetes, the uncontrolled high levels of sugar in their blood can lead to increased thirst. This will in turn cause them to need to go to the toilet more, often having to get up multiple times throughout the night to visit the bathroom. Because the lack of insulin stops sugar getting into the cells where it's needed, people may also mention having low energy, being slow to heal, or even unexplained weight loss. However, it should be noted that everyone is different, and some people may have very few symptoms at all, despite having quite high blood sugars. In some cases, people may only find out when they end up in hospital after becoming very unwell. So how big is the problem for our communities? The infographic you see on screen was put together by the former Public Health England and gives some more detail. I'll give you just a few moments to read through the detail there. On current trends, 1 in 3 people in England will be obese by 2034, and the prevalence of diabetes at this stage will be 1 in 10. Currently, the cost of this is £8.8 billion a year, which is around 9% of the annual health budget. However, this will only rise over time. Diabetes is a particular problem in Birmingham, with rates being around 50% higher in Birmingham, the Black Country, than the national average, and an even higher proportion in many of our at-risk communities. And the impact of this increase in diabetes won't just be seen in the diabetic clinics. It'll also have significant knock-on complications for a number of our different healthcare professionals. On screen, you can see some of the common complications seen in people living with diabetes. These are significantly linked with how well blood sugar is controlled, and patients with poorly controlled sugars are at a significantly increased risk, for example, of the 169 amputations that we see every week in the UK. By reducing the number of people living with diabetes and helping those with diabetes get better control, we can lessen the number having to live with these complications and reduce early mortality from strokes and heart attacks. Diabetes UK have highlighted that hundreds of people are having amputations, strokes, and heart attacks every week. Before moving on to what we can do to help, it's worth reminding ourselves of the things that put someone at an increased risk of type 2 diabetes. The most important risk factor overall is obesity. Those are the BMI, body mass index, of 25 or more, and a waist circumference of more than 31.5 inches in women and 37 inches in men are at a 7-fold increased risk compared to those of a healthy weight. Family history and age play a part as well, with older people and people with many family members who also have diabetes being an increased risk. Deprivation also counts as a significant factor, with the prevalence of type 2 diabetes 60% more common among individuals in the most deprived quintile compared to those in the least deprived quintile in England. This relation is likely highly multifactorial and incorporates both access to treatment as well as ease of living healthily. As you can see from the infographics shown in front of you, we know that certain groups, especially those that are represented across our Birmingham community, are at least 3 times more likely to develop type 2 diabetes than the white population. This likely incorporates genetic factors, but also an element of non-genetic community factors such as differences in diet, lifestyle, access to healthcare and deprivation all play a part. Now, as I'm sure you can see, many of these risk factors are modifiable, and the hope is that by targeting interventions to these, either at an individual or societal level, we might reduce overall prevalence of diabetes across Birmingham. Now that we've looked at the scale of the problem, let's take a look at some of the interventions that we can use to try and reduce the problem across Birmingham. Broadly speaking, the government has outlined 3 key goals for preventing diabetes. These are similar to those that you may have seen in other campaigns for preventing a number of other illnesses, including stroke and cardiovascular disease. By helping people to achieve a healthy weight with BMI of less than 25, supporting healthy food choices and achieving a good level of physical activity, we can contribute towards reducing new incidences of diabetes and helping to improve diabetic control in those that have diabetes already. These goals can also be separated into things that would help for those with diabetes already, but also community-wide interventions to prevent people from getting diabetes in the first place. As a food for thought, I've put up some of the ideas of schemes and interventions that are already in place on screen now. And it might be worth just taking a few minutes to think about which of these you may have seen yourself or in your clients, or which could be implemented in your area of working. Particularly, one thing that we didn't mention in the previous slide is working out who may be at risk of developing diabetes, or those that already have diabetes but don't know about it. Now, this is where something called pre-diabetes comes in. Pre-diabetes is seen with raised blood sugars, but sugars that are still below the threshold of diagnosing diabetes. It doesn't cause any symptoms, so is a good reason to get our patients and clients to be using the Know Your Risk tool to encourage lifestyle choices and get their blood sugars checked. We use a blood test called glycosylated hemoglobin, or HbA1c, to look at someone's blood sugars over the last few months, and anything from 42 to 46 millimoles per mole is considered pre-diabetic and intervention is needed. It's worth thinking of pre-diabetes as a chance for patients to turn things around. One really important programme to be aware of at this stage is the NHS Diabetes Prevention Programme. This is accessed via GPs and other healthcare professionals and consists of a number of group-based sessions delivered in person across a period of at least 9 months. There are at least 13 sessions lasting between 1 and 2 hours to make up a total of at least 16 hours of contact time. These are targeted at people who either have early stage type 2 diabetes or are considered at increased risk of developing type 2 diabetes. They look at the targeting the 3 areas of healthy living that we talked about before and aim to reduce the levels of complications seen in diabetes. In terms of ways in which healthcare providers can help, there are a number of areas where MAC principles can be applied. Firstly, concise bits of information delivered during contacts to spread awareness of diabetes and to encourage health choices. Signposting to NHS Choices or the Diabetes UK websites can also help when you may be stretched for time. Diabetes UK has a Know Your Risk calculator that can be a really useful tool. Secondly, by promoting those healthy choices that we know can be invaluable for preventing a whole host of diseases. Discussing barriers to people eating healthily and exercising might help them to think about better choices they could make. Screening is also vital for picking up people who may be at increased risk of diabetes. In the NHS, this will take the form of the 50s health check as well as screening during pregnancy, but might be considered if patients are having certain problems like urinary tract infections frequently. Suggesting a trip to the GP for a diabetes check is easy, straightforward, and may only need a single blood test. In those that are identified as pre-diabetic, helping them to be referred to the prevention programme and supporting them to attend is vital to preventing long-term diabetes. Currently, around 41% of diabetics don't get all of the aspects of the annual check that they should be getting, so supporting them and encouraging them to get checked is vital. For those patients who are already living with diabetes, there are a number of ways that those who work in healthcare settings, but not necessarily directly in diabetic care, can help to support. First and foremost comes good access to care. Some of those living with diabetes will have significant barriers to accessing appointments or medication, whether those barriers are mobility related, transport difficulties, or language barriers. Helping patients to explore ways of getting around those and attending those all-important reviews is absolutely key. In terms of checkups, all patients with diabetes should be having annual checks, including checking their eyes and feet for complications and review of their treatment plans with their GP. Helping support with weight loss and healthy living is even more important with diabetes, especially those who are on diabetic medicine may find it more difficult to make lifestyle changes. Finally, one aspect that is often overlooked is the mental health side of things. Diabetes is a lifelong condition with some significant impacts on people's lives, and this can often be a burden on their mental health. By having open discussions with patients and talking about their mental health, we might identify those who need more support. Good places to get help include Diabetes UK, Mind, and of course local GPs. So in summary, diabetes is a significant problem with a number of knock-on complications for the residents of Birmingham, and at current trends this is likely to only increase over the next decade. By making every contact count, we can aim to turn the tide on new diabetes diagnoses, and also to improve the lives of people currently living with diabetes in the community. In terms of internet resources, there's a whole host of information out there, but it's important to signpost people to appropriate, trustworthy resources. The ones that I tend to use include the NHS Choices website, which has a good page on diabetes, but also Diabetes UK. For patients that are currently diagnosed as diabetic, they'll have support numbers for their consultants and specialist nurses, and for those patients that might be concerned about diabetes and want to talk to a doctor, a GP is always a good place to start. I also mentioned earlier the Mind website, which is particularly good for those mental health resources. I'd like to finish by thanking you for listening into this webinar.